Good morning.
Good morning.
Welcome everyone to the Shelby County Groundwater Quality Control Board meeting. My name is Sonia Owens. I'm the manager over our water quality branch. Here, we'll give introductions here, and then we'll turn it over to you.
Good morning. I am going to call the roll. Mandro McLaughlin.
Here.
Jason Forbes. Mike Swanson. Chris Moracle.
Present.
Tony Fry. Dave Harrison.
Here.
Quentin Clark.
Here.
Alex Hensley.
Here.
David McCray.
Here.
We have a quorum.
Okay.
Oh, I'm sorry, my name is Horkila Tyson Winston, and I'm the supervisor over the water quality and substandard program.
And we also have Veronica Smith. She's a technical specialist, and Angela Denoni, our water quality coordinator.
Okay, thank you. The first item for the board to consider is the minutes from June 13th, 2024. That is in your packet. It was also sent as an email, so if you could take a look for a second at that. That looks, if you had a chance to review that and to see if these look like the minutes that we discussed in June. Last meeting, we had some new members. We had a presentation on the existing fees and what they cover. And we had some discussion on some of our procedures. Had 3 new appointees. We have a motion to approve them in a second by Quentin Clark. Okay, do we have we'd like to put that up for a vote. All in favor of these minutes being approved, say aye.
Aye.
Any opposed? Hearing none, we have the minutes that are approved. The next item is, and if you have not filled out a card or procedure for going forward, so for y'all to know, do we have 10 cards? We have 7 cards. If you would like to make comments, at least space for 3 more
We have
comments.
space for 3 more.
2 minutes apiece. So if you have comments on what was posted,
6, okay.
we have 6 cards, so we have 4 more positions to speakers. If you would like to fill out a card and have something to say for this meeting prior to its going forward, please do so. Okay. Turn it over to the health department to call those names and come up with a comment. Again, 2 minutes will be your limit on discussion, presentation, thoughts, concerns, 2 minutes apiece for the next 12 minutes or so. Thank you.
Okay, first I have Carl Richards from Protect All.
Where should I
You want to stand back here or you just want to hold the microphone?
be? Sure.
Carl Richards, I'm a protector aquifer, and I'm a resident of Memphis. I want to thank you for allowing me to have a few comments here. You have the fees, the permit fees, and the meter fees that are currently in place are just woefully inadequate to do the things that this group is charged with. The two ordinances and the municipal contract are clear in what they identify as what needs to happen within this county. These include the things like well and septic permitting, wellhead protection, residential drinking water safety, groundwater monitoring network. It's the only way we can figure out where contaminants are going and coming from before they get to what we drink. We need an industrial outreach program. The industries around in Shelby County utilize the greatest amount of water, and many of them are utilizing single pass-through. We need some kind of a program to interact with those folks to upgrade and modernize their water systems. We need personnel that can make all this happen. But before any fees get adjusted and permits adjusted, we need a strategic plan that identifies what all these things are that we're charged with doing and how that's going to happen. There hasn't been a strategic plan for at least 25 years. We need to do that, see what needs to happen, and then set fees that allows us to make those things happen. So that's my only point here, is let's do some serious planning so we can identify exactly what those needs are, and then we can adjust fees to make them equitable and similar to what's being charged across Tennessee or the Mid-South, to bring that up to making this group capable of doing what it's charged with. Thank you.
Next, we have Paul Klein, Climate Reality Project.
Thank you, and it's good to see you all. Paul Klein, oh, we don't have to do the address, do we? I'm co-chair of the Climate Reality Project's Memphis chapter. As I thought about the Memphis Sands Aquifer being the best drinking water in the nation, the importance of each of your positions on this board was really like an aha moment. Wow, what a responsibility each of you has. Thank you for calling this meeting, because the aquifer's on many people's minds right now as we learn that we are getting another huge commercial water user, XAI. Elon Musk has been doing environmental damage and skirting environmental regulations at his 3 facilities in Texas. Just a week ago, NBC reported SpaceX violated environmental regulations by repeatedly releasing pollutants into or near bodies of water. 5 months earlier, the EPA notified SpaceX it had violated the Clean Water Act. Musk's tunnel company was fined by the Texas Commission on Environmental Quality for water quality-related violations. Today, his gigafactory of compute here is being cooled with our aquifer water being trucked in from Mississippi till he can get hooked up with MLGW and draw from our Davis well field at the rate of 1 million gallons a day. I urge you to take a stand on XAI and also the TVA and encourage them both to use recycled wastewater for cooling. Speaking of commercial users, we ask that you increase the permit fees to $700 and hold off on updating meter fees until you have a plan for new programs. The U of M Caesar study showed that our aquifer is more vulnerable to pollution than previously thought, so now is the time to take bold action to protect this amazing resource. I see opportunities for each and every one of you to establish your personal legacy as the first board members in 27 years to produce a strategic plan for protecting our pristine aquifer. Think about it, 27 years ago, the word gigafactory was not in our vocabulary. Maya Angelou said, "Now that I know better, I do better." Thank you.
Scott?
Schaefer.
Yes. I present
It's all right. I think I grew up hearing that every day in class, first day of class. Anyways, Scott Schaefer, Germantown, Tennessee. I'm the science director for Protect Aquifer. I've worked with most of y'all. So you should have all received the groundwater priorities. Sarah sent that to everybody on the board and staff. If you don't have a copy, we'll leave one with you today. Happy to see all the discussion on the agenda upcoming, and we definitely support updating permit fees. But instead of doing it in a flat rate, go by line, look at the cost to execute each permit, what's needed to adequately support staff to do their jobs correctly. So if we're looking at, we need additional staff or expertise, put that into the cost of the permit that you guys are gonna be looking into doing. Also, we request that you all hold on the permit fees until there's a groundwater management plan in place to address looking at wellhead protection, groundwater monitoring, both quality and quantity throughout the county, and also how the board and health department can act as coordinators to the various agencies like TDEC and EPA, and also the U.S. Geological Survey. Those new programs will help guide the meter fees and be more defensible when you bring it up to your respective boards and city councils. And also require that meter fees and permit fees are reviewed every 5 years. That's not written anywhere in the ordinance or the well code. That's something we shouldn't wait another 30 years to figure out that we need to raise prices again. Let's look at this. Again, we have a lot of potential to do more and to do it right, and we deserve that. So, thank you.
Kristen Fox, sorry.
Hi, Christine Fox. I am a community organizer with Memphis Community Against Pollution and a student at Memphis Theological Seminary. Thank you for the opportunity to come speak with you today. I'm going to speak to you kind of from both of my roles as an organizer and as a student at seminary. So, as I was trying to decide what my points would be today, two of the talking points we have from Protect Our Aquifers stuck out for me, especially in light of our covenant relationship to protect and be good stewards of the land, which includes the aquifer, our water. So these 2 points stood out for me. Recent studies by the University of Memphis Caesar have shown that the Memphis sand aquifer is significantly more vulnerable to contamination than previously thought, and that there is young water in almost all of MLG&W's well fields, and our clay layer is more like Swiss cheese. Legacy pollution is headed toward our drinking water supply. So in Hebrew scripture, we are charged to care for the land and be good stewards of the land. I'm thinking in particular of Leviticus 25 and Psalm 19. Leviticus 25 calls for a Sabbath year, a year of rest for the land. And in Psalm 19, God blesses God's people, telling them to enjoy and faithfully care for the earth, and the land shall show forth the glory of God. And I'd like to close by reading from Psalm 19. The law of the Lord is perfect, refreshing the soul. The statutes of the Lord are trustworthy, making wise the simple. Thank you. Y'all can read for yourself. I was going to read 7 through 11.
Ward Archer, Protect Our Aquifers. Come up here.
I'm sorry. Okay, I gotta say one thing. I just wanted to let everybody know that we have 2 celebrities here today that I didn't realize were coming, but the 2 best singers, not only in Memphis, but in Tennessee, Becky Russell and Susan Marshall are here. Would you raise your hand and just let them know? Okay. I don't think they wanted me to do this, but it's, I'm sure you've all seen them play out around town many times, but they're here because they care. I just wanted to say that we want to work with you on this plan. When we first started out together, you know, we were in a really adversarial situation. I remember the date, November 30th, 2016, when we had the public, hearing. You were there on TVA, remember? That was a dark day. A lot's changed then. We're getting along much better. And I just want you to know that, you know, I know that there's some things here you're going to be sensitive about with politics and all, and getting things approved and pushed back perhaps from bureaucrats and such. But I just wanted you to know that we now have raised over $2 million for us from the people of this community, because this is what they want. The people are on our side and they're speaking with their pocketbooks. And our budget is bigger than your budget. What's wrong with that picture?
Right.
So I just want to say that we are willing and able and have been helping. And, you know, we can make things better when the sparks start flying, which I'm sure they will at some point. But anyway, thank you.
And the last, Mercedes Birch.
Hi everyone, Mercedes Birch. I work with Protector Aquifer as well. First, thank you all for creating a space for us to speak with you and share our perspectives. You've heard from everyone before me that the charge of this board and this entity is so massive to protect and preserve our drinking water. We're talking about trillions of gallons of water and millions of people. It's a massive charge, but it also creates a space for a massive amount of authority that this board can step into. And so I say that to elevate these causes and this authority that this board can take on within leadership at the Shelby County Health Department. Don't get me wrong, the permit fees that are on the table for discussion today are a huge first step and a way to essentially stop the bleeding of this department's lack of funding and investment. But it's just that, it's a first step. It's not going to address the financial solvency of this entity. It's not going to move the needle on this larger charge of groundwater management. What we need is that comprehensive groundwater management plan that you've heard others communicate today. And what we need in order to do that is serious funding for this serious gap. The Shelby County Health Department leadership should take this seriously. There should be a grant writer, there should be a financial conversation about filling this gap and growing this program in the way that it really needs to. I'll give you one insight. The State Revolving Fund program, it's a TDEC program that's really funneling a lot of the Bipartisan Infrastructure Act money into Tennessee. It has it's a loan program, but the terms are very favorable, and it also has principal forgiveness that can turn it into free money, and it has set-asides for source water protection programs. So that's one example of a potential path to funding this huge project to address a huge problem. Thank you.
Hey, Chris.
Okay, so now we delve into the reason that we're here, and that is to discuss. We had presentations in the last meeting on the county's current fees, requested fees, and how this will be carried out and what it will do. I think we need to revisit some of that and generally just to have a discussion. So I don't know that there's anything that we will be officially voting on today. We might, but we do need to discuss these rates in our procedure, our methodology for moving forward with these fees. It has been suggested in public comment and in other discussions that there are two areas that need to have an adjustment in the revenue structure for the department. And sorry, Sonia, how do I address your department correctly? Is it groundwater or is it water quality?
Water quality branch.
Water quality branch, which is a subdivision of the environmental branch of the health department of Shelby County, correct?
Correct.
Okay. So there are two areas where we have revenue being generated. And again, this is a discussion we had hoped to have a working meeting, not necessarily public, but I did notice in the code or regulation that says every meeting of the board is a public meeting. So we will try to proceed as we don't know how to do this, because this is really almost a discussion. How do we meet? How do we discuss this? So I'm gonna not say anything for a minute to let somebody else from our board say something. As needed, maybe we raise our hand. I don't know how we do this, raise our hand or how to request to speak. Does anybody have anything to say at this point?
I guess my question is if y'all have any updates or anything that you wanted to help frame this discussion since the last time we talked about the fees.
As far as the fees are concerned, we have no updates. Chris, to my understanding, just wanted to have a discussion with the board regarding how to move forward. So if someone wants to help him and take the lead and discuss moving forward with, all of the issues regarding increasing, I don't know if you want to start with just permit fees itself, and meter fees at a later point. That's where he is.
Are these fees that are proposed here, does everybody feel they're adequate? I mean, this hadn't gone up for what, 30 years?
Correct.
So we're on page 3 of the minutes. I think we're looking at there, right? Page 3 of the minutes has several proposed fees. And one of the things that has been brought up is a 40% increase, the right way to look at it. Or, as has been brought up in discussion, is should we look at the actual operating cost to get that permit processed? Not only, looking, of course, we have some comparisons. I don't really, sorry to ask this, Sonia, but do you have the presentation from last? Would you happen to have that? Maybe we could put it up and just kind of go through it again. I know we've been through it, but to wrap our head around it and discuss particular items. How do we compare? What items should we do? And we need to also know the procedure. I think what we're talking about here is, would you have a digital copy of the parameters? This is where if it were just a working meeting with no public, it'd be a little bit easier, but we're just we're going as we can. We had the presentation from last meeting, and that's worthy of, I think, having up here before us. If we have those, if you keep the notes from previous meetings, which I do have, you can review them in printed form, which I have, but it's hard to present them to everybody.
So now this is the report that you have in your hand. I also have the exhibits. So just let me know when you want to look at one of the exhibits, and I can click on that.
Okay, yeah, I think let's go ahead and go there. And Quentin had something also. Go ahead.
So did you get a copy of what Protector Hartford provided to the board members?
Sarah sent that to you all.
Okay.
I think it's, so your question is, did the county, did the
Health department get it as well?
get it as well?
Okay.
Yeah, I think it went this way.
I think the suggestion is that we look at the permit fees first before we go to the meter fees. One of the things I want to bring up is, can you do a comparison to help with some of the things that Protect Offer brought up? Could you do a comparison? Because I do know that, I guess in Weston, the state administers the program for wells. So I would like to see a comparison. Have you done what their fees are as well as what Protect Offer did, so we can kind of get some alignment? I think the fees are lower than what they need to be because they haven't been increased. But could we get some comparison as far as how the state is administering the program that they have versus what the health department is administering? If that makes sense.
So we have fee. I don't think any of us are, and I don't know about y'all, but I don't think any of us are in disagreement that the fees, as they have been set, are below the operating expenses, below the level of today's cost of living, cost of doing business, cost of wages. I don't think there's any question on that. The question is, in the last week, I've been through discussion with Protect Our Aquifer and considering, I think there's wisdom. We know that we have I would call it a swamp to get through in getting the meter fees changed and adjusted. I would say we probably have a 2 to 3 year process before that can be changed. Based on my experience with the government things that we've had to deal with, simple things, other projects, other things, I think there's a long process. We have several municipalities that will have to agree to changing the agreement. And to my reading of the agreement, there is no expiration date on it. It just is. Majority of those funds are brought in by MLTW, water meter fees. It's the lion's share. It's probably 90%, I would say. It's probably 90, 85 at least. So, it's gonna, and Quentin has mentioned also, changing those fees, they have to adjust to all these kind of things, commercial users, the messages, messaging will have to go out. It'll have to go to city councils. I know the city of Memphis City Council takes a 3-time reading to be approved. So there's a lot of things behind the scenes that are gonna have to happen. And how does that get coordinated municipality to municipality? I think that I almost imagine a whistle-stop train tour of us reaching out to the municipalities and saying, hey, this is what we have, this is what we need, this is why we need it, and this is our plan. I think that it has been, in order to raise rates, you need to verify what you're going to use those funds for and how you're going to use them. So I think there will need to be, again, they'll have to say, okay, well, this is our plan, this is how we will use the funds, this is how many people we need, this is what we're doing, this is how many wells per tech we're getting, per year. This is how much. So I think there's a lot of things to look at in terms of that 55 cents. I also would not be a fan, personally, of jumping to $2.25 as proposed. I think that there would be a rate increase on that meter fee that would be written in to the agreement, and this agreement will have to be re-signed. But it's a set fee. I think that's a shortcoming of the agreement itself. Now, how do we part? If we get into the agreement, we start talking about that, we can spend probably a lot of time on the agreement. But I think we need to get into the actual fees that we have in front of us. So, okay, so here we have permit fees collected. So somebody you want to talk about that?
Can you scroll down and see this? I just want to kind of.
Wait, which one?
Okay. Protect Our Aquifer had a good attachment that they showed. I want to do a comparison of what you're proposing for certain fees as opposed to what they're proposing from some of their things to see if we can kind of come to a conclusion on some of those items.
Okay.
So you're talking, yes.
That's the rest of the board.
Yeah, to that point, so I'm glad this is a working meeting with the public, because I think that they can speak, especially to protect our aquifer better to what they're suggesting. So maybe if we can hear from the health department, the reasoning behind the flat 20%, and then hear from protect our aquifer about the comparison, so we know what we're looking at, the different perspectives we're holding, if that would be helpful. But I think to their point, they've got a budget capacity more than the health department does. And so I think it's helpful to have, their perspective too. But yeah, maybe we can start there, hearing from the health department on the reasoning behind the 30%, and then hearing from Protect Our Aquifer about their perspective too.
That's a working meeting. We're working on how we're gonna have our working meeting, that's right. So I think that's fine.
So to answer your question, Alex, the 40%, we were looking at what we need to sustain our program, and also not to make it so expensive for the public, but just a balance. But also, again, to help sustain our program, what we need, which is that's listed in the report that you have. And then just adding up the cost of the different fees, that's where the 40% came from.
Do you have an annual, let's start up, do you have an annual water fee? Is that the fee is this the meter fee, or is that you have a customer fee?
Like what we're actually bringing in, I don't think that's in here.
In the protect your aquifer, what are they covering in this number?
Yeah, I guess that's what I'm trying to.
No, this is from Protect Your Aquifer.
Yeah, did they present that, so they gave us, that they sent us recently?
Yes.
So David McCray talking about what was sent by Protect Our Aquifer.
The annual water fees, what does that cover? On your post,
So you want to divide them up, or Sarah's not here, so
I can give an overview of just kind of how we approach this in general. So what we did is a line.
that's on the other.
Yeah. You want to share that?
You're going up there.
Basically, we're trying to hear the perspective from Protect Our Aquifer, so we can kind of get an understanding of compared what they're asking for, what their suggestions are versus what the health department see where we can come as a board, where we come to a conclusion.
She's gonna bring up the document.
Yeah, that's fine. So what they've done is taken a list of our fees, and they've increased that.
So what we did is we ran down we ran down as many financial records as we could find from previous audits of the health department. So we pulled statements from fiscal years dating back to, I believe, 2017, 2015 or so. Back then, there was a period of time when there was a bit more fiscal transparency in the health department's audits, and so they would report numbers of permits and have a breakdown of this is the number of each permit that we were processing, and this was our total personnel and operating costs. So I took that older information, and then we had some information that was shared to us by Sonia and Markila for recent, so 2022, recent financial statements that were sort of partial data. We didn't really have a full audited statement on the last year or the year before, but we had some partial information with numbers of permits and personnel fees. So we were able to run down what those costs were, what the number of permits we are kind of assuming based on historical data and the last couple of years. And so we kind of ran through that and made some, from conversations with the health department staff, we also made some assumptions about the hours that go into processing these permits and labor that the board is taking on, or the staff is taking on, plus the cost of water quality sampling, which I know hasn't been done in recent years, so that's not even being factored into this number. And so we kind of came at it from two different directions to reconcile a number that we felt good about. We looked at past data and average cost per permit based on the information we had. And then we also looked at, okay, guesstimating what the actual cost of doing business is in the past couple of years, and worked that out of their labor number. You know, they spend like $32 an hour on labor comprehensively, and they're spending 20 hours per permit, so we think that this is what the permit fee should be. Again, these are not thinking about the cost of water quality sampling, which is a different conversation, because I know it hasn't been happening in recent years. Sorry, that was a lot of rambling.
That's fine.
Scott, do you want to add?
No, that covered it pretty well.
I'm gonna just take a moment and try to get their presentation up on the screen.
Sorry, we've got laptops going on.
I don't know what to take out.
I think from the perspective you took what the health department fees were, is what you're saying, and you kind of looked at what you thought they would be.
Right.
Should be, is what you're saying.
Correct.
Okay.
We looked at the real cost historically and said, okay, they've had X dollars
Current
coming
lab
in,
fees.
and this is the number
all
of
that.
fees. And then we looked at recent, you know, and we said, okay, that gives us a number. And then we said, let's find that number in a second way as well, so that we can feel confident in it. So then we said, okay, let's imagine they spend 20 hours per permit, because we don't know. At their labor rate based on their personnel costs, we arrived at a very similar number. So we felt confident in saying that that would cover costs currently and also track with past financial reporting.
Okay.
And we've got two problems. Problem number one is we're underfunded. Problem number two is once we have the rates adjusted going forward for future, how do we look at those rates in the future to make sure they continue to keep pace with the cost of labor? That has not been done in the past. So I think the one suggestion I think I read, maybe both from the health department, and it also seemed like I was thinking that yesterday or so, is that every 5 years there's a reevaluation period. Does that need to be put into the groundwater, code? Maybe it does. That is a kind of like a tickler system. Oh yeah, we need to be doing that. We have personnel changes, we have groundwater board changes, we have county health department changes, and so having it written somewhere will help us to keep track. Okay, so go ahead, Protect Our Aquifer folks, you have the rates up here, and Scott or Mercedes, you can explain what you have here, please.
Yeah, let me pull up. So a lot.
Microphone.
Sorry.
Just press the button at the bottom,
Thank you. Again, this kind of gives us our breakdown of what we understand to be the quantity of these fees coming through along with our proposed rates, that give us a sense of what the actual revenue could be at those new rates. And again, some of these would also need to subsidize other fees. So if we raise some to a higher level, like the emergency fee, the
$25.
$25 for emergency processing. Anyone can pay $25 for emergency processing, and that's how all the fees can be processed. And then that's a much higher cost burden on staff because they're having to process things faster. So there are some fees that we're recommending down here to increase significantly, or remove options for those emergency permits so that the staff can have a better handle on the overhead of processing these and not be, beholden to emergency processing if that's an issue. But yeah, some of these fees are trying to arrive at a number that can sustain the department on its own. But also we want to be mindful that we don't want to, because currently the gap in revenue has been subsidized by pulling from the general fund. But we don't want to, in correcting this, right, we don't want to lose that general fund support. So making the case for saying, okay, this becomes financially feasible, but also here's what we're going to do with that general fund money so we don't lose that allocation every year.
How How much does the health department proposal bring in revenue-wise? How much revenue would the new health department proposal bring in? I'm just trying to compare it to what.
Yeah, I'm sorry, I haven't done the math on that to be fair.
Oh, no, I was asking, that's, y'all have to answer the question.
Okay, yeah, I'm sorry. I don't know that.
I think that was in your proposal
Yeah.
at the last
I gave
page.
it to Chris.
I see it, thank you.
Yeah.
Sorry.
You have, this is our working meeting, so if someone has a question, you need this to help. Because I can't go through it fast enough.
So it looks like the health department is an additional 108,000.
Well, see at the bottom on the second page, our program is currently bringing in, well, this is just from the meters. So,
174 grand.
Yeah, the 174,000, that's coming in from the meter fees. Our newly proposed program funding needs are $698,299.80, which requires the meter fees to be set at $2.20. This is with the 40% increase in the meter fees. So we did it that way. Of course, I see the point of increasing permit fees first, which would still help our program tremendously. You know, help the growth and the sustainability of our program.
So on your organizational chart, you're talking about funding, on the organizational chart, you have, and we're not, of course, not seeing it, but this from last time I looked at it, so sorry. There's an organizational chart of the department, and it looks like, Sonia, under you there, including you, there are 13 people in the water quality area.
That's incorrect. Water quality branch consists of 6 employees, and then including me, that would be 7. So we have a supervisor, Warkila, Tyson Winston. We have a water quality coordinator. And then we have a lead. And then 4 technical specialists.
Is that to cover all of Shelby County?
Correct.
You have 6 people
Correct.
to cover Shelby County.
To cover Shelby County.
And those, you and Warkila and the other 4, that you are the ones going out to get any kind of sampling, any
So
kind of
our water,
tracking of
we have-
wells.
yes, so we have 2 technical specialists that focus on the water wells, sampling, what have you, you know, new wells come in, repairs. So we have 2 technical specialists that focus. However, they're all cross-trained, so if they need help, another technical specialist will step in to help. The septic program, we have 3 that are dedicated to the septic program. And that consists of permitting, site inspection, you know, approvals.
So you have, I'm seeing in purple on the, and I wish I could put it up on the screen because that would probably be the best thing to do.
Okay, so what you're looking at is the staff that reports to me.
Okay,
I also have field services, which is not part of the water quality branch.
what does field services do?
So field services is under our air pollution program. They inspect asbestos, so it's for asbestos removal, remediation, dealing with demolitions and renovations. And they also do gasoline station inspections for emissions and open burn. So that's totally separate from water.
Okay, thank you, that helps. I saw the list and they were all the same color. I was like, oh, maybe they're all related, but they're just
No.
underneath you as the administrator.
Correct.
Manager, yes.
Manager.
Okay, very good. So the on the right-hand side, and I'm sorry, this is from the meeting it's Exhibit A from the last meeting. And it has in there the organization. And it was stated that there were 5 people, but you're saying the 5 right now would be Marquila.
6. Marquila, Alan Morella,
Yep.
Veronica Smith, Shaquita Bradford, Robert Sung, and Angela Denovi, who's way over to the side there. She's
Okay.
the water quality coordinator. She does outreach, she does the inspection septic, and will help with water. But she is our designated coordinator who does our outreach and education piece.
Okay, right. Now, I don't know what comes first in terms of your funding, but we have 3 positions that are suggested. GIS being one. You have a lot of data that you have to track. You have to track where all the wells are, sampling and sampling results. Currently, how do you use, who is doing GIS for you guys?
Angela Denovi is doing some of our GIS work, and we are working with our IT department. We do have several programs that help us track as well.
And Angela, where did Angela fall in? Where do you fall in this group of folks? You are the quality.
Water quality
Okay,
coordinator.
/ do this / that. Okay, gotcha.
And can the health department share with the rates revenue? I'm just thinking of like, when it comes time to pitch, I think y'all mentioned this, to the municipalities, we're gonna need the reasons. So if you were to pitch that today, what would these additional revenues help with for the department?
Well, additional revenue would help with being able to have funding for equipment that is needed. Training, we need to be able to send our staff to training, there are conferences out there that are very helpful, but we can't afford it. We need like additional staff. There's the sampling piece, and the water sampling, we do have to sample when there's a new well that's installed, or if there's a repair or a potential contamination. We do have to sample those. So that takes up a majority of the funding, or it takes up a lot of our funding. So it would be helpful to have funding where we know, we can do that.
Okay, so to protect I won't be saying it too long. I guess what I was trying to bring up was they have presented this right here. Now I know that you also had a presentation in the previous one that you gave us review. What we're trying to do is reconcile where you're at right now, which I don't hear that they didn't show where your present fees are at, which you just showed it to us. I guess for us to help us, we want to tackle this first, permit fees, and get that taken care of first. And it would be good for us to have a comparison of it based on their suggestions, because I think they're trying to help with the funding. So if we could, I think you may have it, if we can compare it and what it would do for you if health department thinks they agree with some of the things. Secondly, I know that Tennessee, TDEC has their own, they administer stuff for the state. I'm interested in knowing how do you compare with what they do. I think we're doing some things, or you may be responsible for some things that they're not actually doing in their program. So I think the fairness to us, we need to understand what that is. So we can kind of get that, that'll help us. I think we're on board with at least making that pay for the program, pay for itself. Then we can get back to what it would be for the municipalities to do. So is that something that I guess that you can do to give us some kind of rundown of this is where we're at with these? you can use what they have as a comparison to what you would propose. The rest of the board agree.
I'll agree.
I don't know, how long would it take you to do that?
So that's what I was gonna ask, so do you want me to, or do you want us to send that to you all via email, or are we gonna wait to for the next meeting?
I don't know that we need to wait, but we can bring it, I think when you have it, we get emailed. We'll also need to put it into the minutes or we'll need to present it, but I think having an email will definitely give us more time to look and consider and chew on it. But I think we should put it in the open record, in the meeting. So I think both. Yes.
Okay.
And on that point, related to our communications and even having again, this is funding, a website. Having our, Angela, sorry, I don't know your name well, Angela, someone equivalent, having a web poster, having example. I work in the SART 10 program, which is a consent decree driven program for the city of Memphis regarding wastewater. They have their own website called SART 10, and we regularly update it. We pay a management fee for that, and we put all of our contracts, we put everything there. We have a message from the mayor, we have a lot of stuff there, where we're working, what we've done, bids that are going out. Here similar to Protect Our Aquifer, thank you for posting the things, our minutes are recording now, but that gets posted. So you would have a documentation of that. And eventually, in our safety meetings, we have some safety-wide meetings for the SART 10 program. We have a recording of you can record the meeting and have it transcribed. So there's really quite a bit that can be done for public communication and outreach. So now, back to our fees, I think. So I'm sorry, I jumped to another point. Quentin would like to have and I agree, the board, no, I'm sorry. The board would like to have. No, I think it's good to have the comparison. Really, we're trying to dial in where we need to be. We're trying to dial in. What is that rate? Is it 40%? And I understand the health department's view. I very much appreciate that. Is what's good for the residents, what's good for people, how much do we start charging? I don't know how this works out, but shock factor, I think it's wise it'd be good to have a rate structure that increases over time, rather than throwing somebody a sudden, hey, the fees are going to increase, let's do $100 this year or $50, and we need to consider how we deliver the rate fee increases for these permitting. So not the fact that we just go, okay, all right, we think it needs to be, and maybe it's true, but we have to be able to work that out with all the residents of Shelby County too, and municipalities. So we need septic systems. Does somebody decide, I'm going to go put that septic system in on my own? They shouldn't. We hope not. That's not legal, right? That would not be a legal move. But if they think they can avoid something and get away with it, they might try. Particularly so again, understanding our delivery of our fees and how we're going to do that. I'll pass it.
So I think when you do this, I think you also need to have something on another column that says what it is in other municipal, or what the state charges as well, so we can get a feel for what the surrounding counties are doing. Because what you would do is you'll drive them to other counties if you're not careful, and you won't get the protection that you're trying to get for the entire aquifer. So at least need to know what that means.
So I would just offer, on our part in doing this research, we also have different activities. This was alluded to earlier, but I think that we have more permitting activity than the state does particularly concerning wells. And so that just would need to be clarified.
That's what I was asking too before. If it's something that you're doing in addition to what the state, and I think it is, you're doing more what the state does, we probably need to highlight that. You got something to say?
Well, I was just pointing out that like the septic fees is based on TDEC costs for the rest of the state. So it's just like, we're just trying to.
Yeah, I saw it in your present.
Yeah, so.
That's kind of what I was mirroring.
Yeah,
You
but
kind of,
with regard to well fees, that's unique to Shelby County. So that's just kind of.
And also it's the intention that Shelby County is going above and beyond in the services that it's providing and the due diligence that's going into these permits. That's why the contract is with Shelby County for well permits. So that being the reasoning behind that would justify higher fees, in my opinion.
okay, that's fine. We just need to have it outlined when we do that so we can know what's different compared to what we're doing. I'm trying to get a net nucleus of what everybody else is, what the state's doing. If the state came in and they had the program, what would they be doing in comparison to what we're doing based on the ordinance?
I don't know what the board thinks of this, but I wonder if the health department and protect our aquifer could meet before.
Thank you.
I wonder if the health department and protect our aquifer could meet before our September meeting and have some kind of collaborative proposal. So if y'all can talk out whatever the difference is between your proposals so that we can move on this quicker. I just imagine we'll continue to go in circles if we don't have that in between. What are y'all's thoughts on that? Yeah.
I think it would be to the advantage.
Would you allow me to offer my services to run this mic after you're done?
Yes, sir, I don't have a problem with that. I would think it would be to the advantage of all parties. But the next time that we meet, we have a simple comparative analysis. This is what we need. This is what the past was. This is what everybody around us is doing. And then we can come to a consensus, make a decision, and then go with it. Because you do need the funding. You do need the help. We're here to help. We're not to be I'm new to this, so everything is new to me, and to a certain extent, I'm a little bit boiling over some things because I understand working in a skinny environment and having a lot of work to do and a lot of work to cover at the same time. We got to talk about fiscal responsibility and then servicing the great people of Shelby County. And that's what they're here for. That's what we're all here for. I think it would do us very well to have all the numbers before us and do the comparative analysis. We could even, like Quinn was saying, we could do the step analysis as well, where you increase a little bit more, where it'll be a little bit more receptive, it'll run people off, but you're getting what you need, and the people are getting what they need. Water's being protected, you're being able to have everything you need, and it's not gonna kill the average homeowner and the business who's actually doing it. We just gotta see all of the numbers so we can cover all of the angles. I think that would serve all parties very well.
We're gonna do that. Thanks. Anybody else any other members want to make a comment? Do you want to comment on what we're proposing to have happen, something with it?
Well, I agree. Thank you, Andrew, for that. And like, that was also part of the 40% because we didn't want to have this drastic increase. So that's kind of where our thoughts were, but go ahead.
Okay. Now, this I just want to make sure we're on, so that's a plan. And I want to also see, can you not overload the plate, have you looked at some of the things that the state, I know you say what they do, but you say you looked at those in comparison as far as, can you, like they have a well bureau map with the well data on there. Is that something that the health department can use as opposed to building its own, or I'm just asking that question? It might not be an answer now, but I just want to present that. Is that an option?
I can't speak directly to that. Would it be beneficial? Would it be helpful? Absolutely, yes. I can't speak to the administrative side of that.
I'm just trying to say, the state's already got a data viewer that is supposed to have all the private wells for everybody. could we not take advantage of that opportunity and use that as opposed to trying to create something new?
We do also use their well data information as well. So we try to use all our resources the best that we can.
I think they quit maybe asking, could we integrate? Is that your, is that
Yes,
correct?
is that a way, because without you having to recreate everything, if the state has this, can you use theirs or reach out to them, hey, would it be good if you could add this on here, we can supply
Into there.
as opposed to you having to do a whole lot more GIS work.
May I interject? You can talk with Richard Rogers with TDEC. He's in the national office. He manages the data viewer website with the wells.
Can you provide that information for the health department?
Yeah.
I'm glad we're looking for ideas on synergy, because I believe it was mentioned that previously you had in-house sampling, and we don't have that now, and that's the reason the cost for the well, is it commercial wells or all sampling of wells has gone up to about $500.
We used to have in-house testing, correct?
Right.
We used to have in-house testing. We don't have in-house testing.
Correct.
Correct. And so we went outside, the cost has increased. And it goes up every year.
So according to the state on testing of water quality, it just says it strongly recommends private well supplies be tested annually. How do you, the programs of the health department, how's that monitored? Are you going above what the state does?
Yes. So historically, we were sampling every year, trying to do at least 90% of the wells every year that we can get to. So, yeah, so we were trying to sample, trying to keep that information. But when our lab went away, is when we had to start seeking an outside source, and the lab fees, per site, not per site, per well at a site. So if they're paying, $100 and we're paying $500 for each sample, like I said, the math wasn't that. So that's why another reason why we asked for the increase in funds. But we are, to add to that, we do have to do the sampling according to our regulations. When there's a new well, modified, repaired, or if there's a risk of contamination, we have to sample those, and we do. But, our budget, we just have to stay on a budget. Yeah.
Who should pay for it? If that's the private well owner's well, should you not charge them and make them responsible for getting that test and say this is a list of approved labs? You have X number of days to get it done, else you cannot use the well.
Well, that's part of the fee, right?
But you still have to, they would still have to sample it to keep the chain of custody intact. You don't want the fox door guarded in-house.
And if I may too, part of what Protect Our Aquifers' larger financial modeling has been, we've been thinking about like conservation fee and all these other fees, but also like what to do with the added revenue. We thought it might be a mindful way to kind of transition, instead of saying we're testing everything every year and spending tons of money. What if we got into a 3-year rotation and offered, and then did a third each year, and so we're sampling every 3 years to kind of lower that cost and make it something that could work within the budget confines.
So you're saying that you just want to chain of custody, you want to go get the sample and take it to the lab. So, but who's supposed to pay for it? That's the point. I don't think it's fair to make the meter fee, the program doesn't pay for itself, and you're always funding it with ratepayer money. It should be paid for by a private owner.
I know David was worried about the hen house and the fox garden, but you would ideally get the sample be pulled by, say, maybe InSafe, or have someone like of that nature, or by the lab itself, have Waypoint pull the sample and then test it. I mean, professional services. What are the samples that are required for this test?
So after a new well, get a new well that's drilled, if it's been modified, repaired, or there's a potential risk of contamination. So it's not required that we sample every well annually. We were sampling because we were going above and beyond. It is a good idea to possibly do those every other year, every 3 years, to just ensure that, you know, the groundwater is free from contamination.
But as far as analytes, parameters, required analytes, what are the required analytes for each sample? And you've pointed out that any new well has to be sampled.
That total coliform, E. coli, or
Yeah. So in the regs, it's E. coli, and then, but CDC recommends E. coli, nitrates, total dissolved solids, and pH. So
really quite short.
it is, but if you look at total dissolved solids, that gives you a breadth of what's in the water. So if the TDS is high in the Memphis aquifer, you're only looking at, it should be low, total dissolved solids in the Memphis. But if it's high, you know, something is in there, and that's the trigger when you sit there and say, we should probably sample for X, Y, Z, and then go further in depth.
That's where you have somebody reviewing that knows what they're doing.
Yeah.
Can finally, pull that out.
Yeah.
It's a red flag.
How, just out of interest, how many of the wells that we sampled over the last 5 to 10 years have had problems with them?
That was just gonna be my question. Just a simple positive, negative protocol, and what are the parameters? What's a trigger? You know, if you've got so many colonies of total coliform, or you know if it's E. coli positive, you're gonna have some, it's a well. It's not gonna be, but there has to be some sort of play. And who pays for that? You know, and if y'all are having to foot that bill, there's gotta be some help somewhere or support. You're gonna need money to do that. The testing is not cheap. Private companies or places like Waypoint and Pace Analytical and other places. It's a lot of places to do that. But what are how many wells are pop positive? And then what's the protocol if it does? Like, we're not doing that. You shut them down, or they're gonna have to dig deeper or more further analysis. Those are just some small questions. But if you can get, but it takes money to answer those questions. I understand that.
And I know my question was asking for more and deeper analytics, like a holistic analytics of the process. So if you have the analytics, do we need to be testing for, I think I saw some of the parameters, maybe copper, the metals. Metals are maybe $15 an analyte. They might have gone up. But, should we do it that way? Or, and the synergies. So getting back to synergies, we had an inkling of possibility that the contract lab could be another municipality's lab. Could that be a possibility of a fixed cost? You pay, you're still going to be paying them, but could there be already labs that are being used? Somebody that worked for the city that now works for someone real close, an entity real close that had said, brought up that they might be able to do that. Do we have to look at capacities and throughput? Okay, so these are some things that we can do to maybe help the health department not be in such a bind, really, in terms of the finances. Now, we look at the list up here. Let's just look at it again. Annual water fees. I think that's meter fees, correct? Is that meter fees?
No, this does not include meter fees. This is just the permitting fee.
It just says permit fees.
Yeah,
So
this is
I think
just to support what's being done.
So I think on this, I think we're set on what we're gonna do on this, right?
Yeah.
I think we're set on this. On water quality testing, sounds like we need some kind of review as far as what we need to do. And I do realize that the health department may not have everybody that's you know, in that spirit. So we have to figure out what it is we need, because the state's not doing the same testing. Not at all. So I just want to make sure we're what can we come to that's reasonable for us to understand what's going on with the aquifer and then kind of get a heads up to prevent any kind of contamination. So I guess that's some thought. Maybe that's a discussion that when you meet, you can have that discussion. We can see what the results are, so we can kind of figure out what to do about the water quality testing with POA. Maybe we can determine what it is we can do. And you can talk with TDEC as well, as far as it may be our requirements, the ordinance is calling for more than what the state does. So we just need to figure out what it is that we want that to be.
Are the permit fees the only thing that the private person is responsible for? The permit fees are the only thing that the private, like a private well owner is responsible for at this time. Like if they just pay this fee, they're able to do the well, they don't have to pay anything else, or after that, they don't have to pay for the testing. That's on. They pay every year. They pay something annual every year. They pay annual. Okay. That's the annual water fee.
That's the annual.
Yeah.
But the private wells, from what I read, the private wells don't get tested.
No, yes, right. I'm sorry. No, the residential wells do not get tested. That's their only source of water.
Yeah, they're exempt from paying that annual fee. Private well owners that don't have access to public water supply. So if that's their only source of water, they don't have to pay that annual fee.
So if they're in the city of Memphis and they have water, they have delivered, they're going to be paying an annual maintenance fee.
They will pay that annual.
Or an annual fee, let's just call it that way.
Right.
I mean, it needs to be GIS in any kind of way. That's some kind of maintenance, right? I mean, you guys are putting effort in if there's a well there. We have to, and then eventually we should have and it's been discussed in the requirements for, I think it was agreement 9955, that there would, and also in the ordinance or the code, I don't know, I'm probably mixing words up, but that there would be a plan to look at the entire system and know where those wells are, how much water is being taken out, all kinds of things. And I discussed this with Protect Aquifer yesterday, that there would be, Caesar at the University of Memphis is doing such work, and they do it for, I think, was said MLW, I think, and it's about in the order of magnitude of around 300,000. So that may be a yearly amount, I'm not entirely sure, but that, or if that's a contractual amount and it spreads over several years. But anyway, these will be things that we need to look at as we begin to have the revenue available for the department.
So we can pivot. I think we finished on this, and then the meter fees will be after we determine what the permit fees were. So I think that'll come back, because you may change your amount, request X based on what happened to permit fees. Right. So I'm going where. So let's talk about, I think, Protect Aquifer. We're talking about what's in the ordinance. It's groundwater plan, and also I heard wellhead protection plan. As for municipalities, we have to comply with the wellhead protection plan. So I was trying to see if I could get an understanding about what we're saying wellhead protection plan in regards to the board. What are we really asking for? If Protect Aquifer has some suggestions, I'd like to hear. We'd like to hear what that was. I think.
So it would be, instead of looking at the wellhead protection plans in isolation, because each municipality and utility has their own wellhead protection plans. So Germantown, Bartlett, Collierville, Donington, LGW. So LGW has 10 well fields, and that's all that they look at. It's just their well fields. Germantown, just their 2 well fields. Collierville, just their 5 well fields, so on and so forth. But the point of bringing it all together would be, with the support of the Shelby County Health Department and appropriate staff to do this, would be to look at all of the well fields all together. Look at where there may be some development issues or water quality issues within an individual utility, and see, well, is this an issue for Collierville? You may do this internally already. You may be like, well, we're having this water quality issue, and we're seeing it over here in a nearby well field, because like Cord and Bartlett well fields come under wellhead zone 2s intermixed because they're close together. So again, it would be like a coordinator to sit there, talk with TDEC, look at different water quality issues that they're seeing and keep up to date, maybe just like an annual review or something where they talk about different sites like former custom cleaners, national fireworks, whatever other contaminated, there's many of them that cause issues, especially in the shallow, but when you find the breach or in unconfined areas, these are the areas that you will start seeing more and more issues. So that would be the point of the meter fee. We are all paying this meter fee, so we use that meter fee funding to support these programs that are supposed to be looked at. Huh?
I said, I don't have a question.
But yeah, and then also looking, and the meter fees would maybe help support like groundwater monitoring network. So again, MLGW has the USGS that monitors their well fields and some wells around, and so Germantown pays into that as well. And the University of Memphis Caesar, they also do water quality monitoring and a lot of monitoring in the shallow aquifer. So again, a coordinator to pull it all together, to build this network, to make sure there's no duplication of data, and to make that data available in public, because a lot of it's held in, like, Caesar will hold the data because it's based on contracts, so it's not made public. So it doesn't go into the USGS database, which is another thing. Like, they collect their data, they write their report, they publish it, it's all public data. So you can go to NWIS, National Water Information System website, and pull whatever water quality data or whatever else. So what's that mechanism to take the data that we're collecting, push it out to them? Because you gotta pay them to QA, QC the data, make sure it's collected right, blah, 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 all that stuff. So how do we get the data to the public to be used to the health department to look at that water quality and identify these issues that maybe, like TDEC may know about issues, but it's not conveyed to the utilities or the health department. And it's just those silos and barriers that we all deal with and bang our heads against the wall in frustration. At least I do, I don't know about y'all, but how do we get this to work? And maybe, just maybe, if there's correct funding and the right expertise and staff and everything in the health department, to push that forward. And that's the dream. Like, that'd be the Cadillac version of everything. But, you know, right now we're just struggling just to permit. And in reality, the meter fees are subsidizing permitting in private wells just to keep it floating and going. And to me, that's not right. I'm paying 55 cents a year. We all are, right? We all live in the county. Whoever's pulling public water supply. So, like, let's put it to something that's going to make a difference and put it to good use.
Okay, nothing more.
Thank you. Yeah, so I think what I'm looking at from Protect Our Aquifer is that we need the wellhead protection plan, but that we would do the permit fee first. So I guess my question is, what else do we need? This is for the board, for Protect Our Aquifer, for the health department. What else do we need to have this collaborative plan? In my mind, I hope that we can move forward on something in September. September 12th, we're meeting then, right? Okay. Yeah, so what other information do we need to feel confident about that to then present to the public and then move forward through the legislative process?
I'll jump in real fast. So on wellhead protection plans, because we've been doing it, we have been using Caesar for those plans, and I think each municipality also does the same thing. So I was just curious as you kind of explain what it was. We already submitted to the state and we look at them. So usually if we have anything that's going on in well fields or something that may commingle with somebody else's, we would reach out and contact them or bring Caesar and see if it's something. we also get some updates from TDEC, the local TDEC person. I know Custom Cleaners is out there, and they've been pretty good about communicating to us about, as far as what's going on at the state level and with the health department as well. So I'm trying to, I don't know if that was related to private wells or exactly what. So I think that's something that the municipalities have to go back and look at and see how they do see an issue with what's going on right now with the health protection plan, because that's state purview right now on the EPA. So we have to see if that's something that's, that's an issue, a major issue for the municipality. For a groundwater plan, I guess I want to hear, it's in the ordinance, but I'm trying to, what is your suggestion on the groundwater plan? I don't know if I want to put you on the spot, but I know Protector Aquifer has been kind of at the forefront of that. So, you have some ideas on that, or I see Ward's coming up to the front. I don't know if he wants to talk about it. No. No, that's not for you. I'm just trying to, what the groundwater plan is in the ordinance, what I'm trying to figure out the direction we want to go with the groundwater plan and what that's going to gain. And it may not have all the answers, but we're trying to see where we want to develop, what we want to develop.
Well, I mean, so we were kind of coming up with areas of like looking at residential drinking water safety. And that could fall under wellhead protection plan, but identify sites of contamination when we're, and that's part of the permitting process. You don't want to put a well next to a dry cleaner and you got a bridge right nearby, right? It's not what you want to do. But again, with regard to wellhead protection, you're right. It is under the purview of the state. You guys submit all that information, but like it would just be an extra added support of them acting as kind of like what Caesar does, but again, taking that information, looking at other sites that may be outside that 40-year time of travel, looking at it countywide. They wouldn't have to report it. It's just an added thing too. So if you're dealing with, you have your 40-year time of travel on your zone 2, whatever, but you got a Superfund site right outside. So that may be something that you may not catch and Caesar may not catch because they're basing it on the models. But it's like you got to deal with that. That's something the health department can help with. Looking, talking with TDEC and saying, look at this contamination. You may have 60 years before you're going to see this contamination hit your well. So on and so forth. I don't have all the answers, but it's something to like. We're working on almost like a thesis. This is great. Of all this type of stuff. So we're working on it, and hopefully we can have that available for some of these discussions. Go for it.
I think too, from Protector Aquifer's perspective, we're interested in addressing these permit fees first and coming to an agreement on what works for the department, what works for the public. I think these other bigger conversations about these elements of the groundwater protection plan that we're talking about are a great special project that the department could put together a budget for to request grant or other loan funding to do that work with an independent consultant or whomever, or a collaborative. So I think like all of these things are a huge discussion that we should be having, but for now, we're not going to solve them until we get some funding, which is available out there to actually build that plan together.
Understood. Does any members have any thoughts about some of the things we heard about the groundwater plan or anything? Is there any thoughts there?
This is, I think, sorry. This answers Alex's question, I think, is like, how do we go forward? And someone has thought about that to help us, which is good. Potentially, here's our meeting on the 22nd. Where it's been presented, fee increases. Not sure what the well code red line is there. I suppose, okay, on that matter. One more thing. So, presentations only. I know how to pull in lots of things, but when we make changes in well code, I suggest we use red line versions, which makes sense because I had trouble following the last changes we went through, and so I think that would help to have the red line version of Word where you look and can see the changes. But there was some red line changes suggested, I think, in the last meeting, and I don't know, did we go through and approve those, or did they need to be approved from the changes? Remember the changes? Yes. So maybe that'll be the next meeting that we have in September. So just,
And those, they're still on our website. You can go to the website and see the revision.
I think when he's saying red line, I think what he's referencing is you had to actually have red lines in there as opposed to just reading what the change was. You see what the change was with the red line.
I think we had some yellow highlighted versions.
It's yellow and green for one section that you guys looked at. I did not report that y'all voted any changes. It was just a review.
Okay, so anyway, that'll be something going forward. So we have Groundwater board meeting. We're discussing now the potential changes we've requested to compare. I think that somewhat in this document, I'm looking on page slightly above this, just a little bit up, yeah, right there. And it discusses that the 40% is according to the actual dollar amounts. It sounds like maybe Mercedes, you worked on this in terms of the actual dollar amounts.
Yeah, that's correct.
I think the health department was realized that this wouldn't meet all the needs, but it was a gradual, it was a compromised rate to try to meet everybody's need. Because if you go for the full amount, there is the shock and awe probably that hits right away. Of course, after that, maybe people go, okay, well, this is what this costs of living, but I think we're all getting shock and awe from the economy.
And we're also interested in reducing the subsidization of the meter fees on private wells, as Scott mentioned earlier. So that's why we're taking the approach of how can the private well fees and the permit fees sustain themselves, so that we're lessening that dependence on ratepayers.
I think we're good on this. I think they're gonna get together and come back and get us something at the next meeting. So I think that part, and before we move on to the rest, I think we're good on that. We got an idea of what they were talking about the wellhead protection plan, so we'll kind of understand that. The groundwater plan, I guess that's something we have to determine what's the next steps on that. And I'm trying to think what else for this working meeting that we need to discuss.
Yeah, I have a couple of things. I do want to say I have worked to pass more than 10 laws in Shelby County, and what I have learned through that process is I think we can shoot for the moon first. So we advocate for what we think the health department needs, more than this 40% hike, that we find whatever the compromise is with Protect Our Aquifer and the health department. And I think we can anticipate the legislative bodies to water it down. So that always happens. So I think we shoot high and rely on the legislative process to compromise it more than we already are. So I just say that to say, my recommendation is that we do not compromise on our end and trust that that will happen for us. And two, I think, so I asked Jill the question about what you need, equipment, training, added staff. I think that's great. So I think in addition to the proposal with Protect Our Aquifer, that if we can get just kind of the technical breakdown, I think that will help us see what this funding is going towards. And then once we get to that legislative process, we'll have the technical breakdown of what the raised fees are going towards. So I think that could be helpful to just see even a draft of that for the next meeting, if that sounds right.
I think that's good. And one of the things I was thinking, as the revenue starts to increase, I think there needs to be also stepwise building of the program. As you're building the program, you could have more funds than you know what to do with initially. The program needs to gradually build up as the funds are also building up, so that you have a kind of keeping step one with the other, staff, program, sampling, and funds. All of that has to be balanced so that there's, and what would happen if there's an excess of revenue, then what? What do we do with that? How do we use that? How are accounts set up at the Shelby County Health Department? Is it a separate account specifically, uniquely, legally bound to be used for groundwater? Or is it, oh, well, we've got this extra money over here so we can go use it? And I think that was mentioned, and I believe it's in the agreement 9955, that there was a base level of funding already from the health department. And that agreement 9955 is an additional amount to what was already being provided by the county health department. So I think there was a recognition that that wasn't the full amount. There was a funding already presented, already available for the health department, and then there was going to be additional amount. So I think that needs to be considered too. How do we, make sure our funds, for example, there is a sewer fund. That money must be used for sewer capital improvement, sewer repair, it cannot be used for something else. Do we have, I guess it's called an enterprise fund. Is this an enterprise fund? I don't know I'm glad we have some legal here. And how is that required as far as funding and the money that's coming in from revenue, from permitting? Is it required to be spent by within the groundwater department or the water quality department? Any thought on that? I see a couple of people that may have some insight on that.
So I'll take a stab at it to begin with. You did say a lot. One of the things I would like to see that I'm constantly working with my team on is when I came on board, there was no, let's talk about the aquifer. Let's start there. And I'm always looking at, because we were not, I'll tell you might as well, looking at that to begin with this board, that now, to address some of your concerns, Chris, I don't see any overage as far as money. We need to grow exponentially to catch up to what's going on with our aquifer. One of the things you guys mentioned as far as the testing part of it, I don't want us to get rid of the testing. One of the issues that I have that I don't think we've been more vocal about and upfront about when being totally transparent with that, we collect all this data on these wells. Do you guys see it? No. Do you guys even know what's going on? No. And that's one of my big pet peeves. We're sitting on this data and doing what with it for the public? So there is so much that I see the potential for this group, for the health department, to totally expand and take more ownership of our aquifer, to support you guys, to protect the aquifer, and everyone that's concerned that picks up a glass of water to know that it is truly safe. And I think we're doing some of that service, but it's so much more we can be doing that these funds would help augment. When we look at, I know we say very broadly as far as staffing, we're just not going to say, oh, we're just going to hire a clerical specialist. No, we need subject matter experts as part of our team to be part of our body. And we acknowledge that. So I've been trying to speak, sorry. But you can tell I'm really excited that if this does pass, how much more we can do. I tell my staff all the time, don't worry about the space. Let's get the bodies in here first so that we can advance our program to be where it needs to be. No faulting anyone, but we are going exponentially as far as looking at our aquifer, as far as the public's input, as far as these companies coming into our area. What can we do to strengthen it? With our little staff here, we're just putting a pin drop in it. That's it. And there's so much more that we can do. When you look at other programs, just even across the United States, that I'm like, oh my gosh, if we could just get halfway there, that would be awesome. So on that part of it, that's what I wanted to say. To the other part that you were asking as far as the funding. So the way the county has it set up is that if we have permit fees, that money is augmented back to permit fees. The manager and the supervisor looks at when MLGW sends us, hey, this is what we've collected this month, it goes into that account. And that's our responsibility to make sure that that money is appropriated in the correct accounts. So we will keep that practice in place, and that'll be something we can report out to the board. Do we report out to the board now? No. Like it was mentioned, we don't know you guys' budgeting expenses. Why not? You know, that's something that we can do. You don't know I have like a rattle. I sit here quiet a lot of times, but there's just so much in my mind that I want to do with the program. But again, it's just kind of frustrating because we don't have the funds to get there. You know, and I'm glad someone mentioned, I don't want to lose the general funds as well. Right now, the general funds is what's helping us do some of the testing that we're doing. So I do want to make sure that we do keep some in the pocket of the general fund to help augment some of this. You know, I think we have a long way to go. I love the idea of let's start here, here, here. And with the notion, we're going to continue to move here, here, and here as well. I know it's a lot we need to tackle, but we have to be realistic about how we're going to tackle it and what's going to be the priority of it. Some of it's going to have to be, we're going to do this in a lane by itself, and then some of it's going to have to be double highway. So just keep all of that in mind going forward. I don't know, I want to introduce, this is Freeman Chandler, I'm sorry. She is our attorney for the health department. She's new to the program, and she will be our representative hopefully for a long time.
Thank you, Casey. Yes, I'm Assistant County Attorney Reagan Chandler, and I will be assisting the health department. So if you all have any questions that I can answer on behalf of the health department, legal questions, you can feel free to email me. I know Alice has done that already. So yes, I am available as a resource as well. Thank you.
Thank you for that. That's encouraging. That's what you're looking forward to doing. And you are right. Initially, when it started up, GWI, the former Groundwater Institute, now known as Caesar, was a key component, and you were able to have a contract. But I think that dropped over time due to funds and money. So I would hope that we can probably figure out how to make that work going forward, because I would expect that you're going to have hydrologists on your staff. So I think that's the benefit of trying to reach out and do some things like that to see if we can reestablish that. I would hope that Caesar's reaching back out with some of the aquifer study things they're doing, that they should have been reaching back out to the health department and seeing how they could help and participate in some things that could benefit from the research they're doing. So hopefully that's an avenue that can occur. So I'm trying to think. Alex, you're thinking over there. I can see it.
Thank you so much, Casey. That's very exciting to hear. And I know this has been a struggle with the resources that y'all have, and I appreciate what y'all have been able to do to increase public engagement, to really try to work with us to get us here. And to your point, Casey, I think I just wanted to put it on the table that whatever we draft up, that we could potentially have a dedicated fund, so we make sure that that's part of whatever we suggest, that there is a minimum level of investment into the water quality branch every single year. So just want to put that on the table as an idea to include.
I know I was late, but just 1 minute. I think it'd be helpful. I work for 3 labs, 2 wastewater treatment labs and a water lab. Actually 4 if you include Monterey District Water, California. And the way I got my degree was a connection through the city college. And we were all volunteers as lab workers. So it went from the college, and then we were volunteers working in the labs, and then that's the way I got my first job. And you're talking about funding and training and expansion. There should be something in Southwest to train the lab people. And half my work before I got a good job, it was a volunteer, and I tested wells, I ran the seismometers, the microscopes, we did all kinds of tests. We did daily tests, weekly tests, we did monthly reports, and we did it all for free as volunteers. And that's the way I got my job at Monterey Water District. And that's how I got my license. So if you want to save some money and get trained people and only hire people who are already trained, you could easily start a program. Kids need to be knowledgeable on water treatment, lab treatment.
Thank Thank you. So again, another piece of relatedness would be education, which we haven't really touched, but that did touch on that, so that's good to consider. We did talk about potentially synergies with our water quality testing labs that we have at the municipalities, so there might be some savings there. Some synergies with the state and the GIS. We talked about comparing the rates proposed by the 40% increase versus the actual fees of the actual cost. We talked about wellhead protection. Any other items that we touched on that we needed?
It's hoping that we come back, we can, he can work it. She wants to use the agenda.
Oh, okay. So, okay.
And I just want to say thank you for everything that you've done over these past years trying to make those improvements, because I know it's a lot of work you put in there trying to do it, and boy, as a board, we want to say thank you.
And to Alex's point, also if we would have, I'm going to ask a question, I don't need the answer now, but if we could have the answer at next meeting. And that would be, what is the actual next step for making, what will be the actual getting the numbers change for permitting? How much when will it increase it? How will it increase it? And how that process works. We know that we're talking about the numbers now. If I were to say, board, do you want to agree to $700 for a commercial well? And they said, yes. Does that mean it's effective now? Or does that mean that we have said it and now it must go to what step next? Does it go to the county? Does the county then have to, okay, Kate, sorry, Raven.
Okay, so I'll start it off. We will approach this just like we've done with the pollution board. I was at City Council yesterday speaking to Shelby County Commissioners. So normally what we do, we will start there first. Then once we do that, just like you, everybody's going to do the 3 readings. What we've done in the past is actually our staff, along with you guys, we will go out to your various municipalities, letting them know this is what's occurring before we go to Shelby County. We got to get you guys buy-in prior to. So we will go to your leadership, you set it up, we'll be there to meet with them to discuss what needs to happen. Unfortunately, I've learned, kind of like Alex, we're going to be on their timeline. So please keep that in mind, that it will be on your area's timelines, and I know everybody's busy, but we have to be cognizant of that. And then going through all of the readings, we do understand will take time, and that's something we just have to express to the public. So going back to you, Chris, once Shelby County adopts it, technically we can start enforcing it. However, your areas would have to say, yes, we're going to piggyback off of, and I know City of Memphis has done that before when we've done the pollution control ordinance, is that they have said we are going to automatically go with what Shelby County has passed. So it's still in there for the pollution, I know, control regs, that's how they do it. But we could set, we can't realistically set an end date until each of the municipalities have put it in stone in place. But as far as unincorporated Shelby County, it could begin immediately.
Let me ask a question. So the permit fees, I guess it gets all the permit fees, do they have to go, if the board approves them, or is that it for the permit fees, or does it have to go before each?
It still has to. So that's what happened yesterday. I was there for the air pollution, Memphis Shelby County Air Pollution Board, and they approved fees to be increased May 9th. It just went before City Council, Shelby County Commissioners yesterday, and that was just the first reading. And you did hear me say May 9th, the board approved it. It just got on the agenda, and I was there yesterday. So it tells you how long these processes are. It's not overnight. And I did mention it yesterday to the commissioners. It was unanimously approved by the board to increase air pollution fees.
So for the purpose of those fees, is Shelby County approval and City of Memphis approval? And what about the other municipalities? Is just really that function for the permit?
It's gonna, most of the industry that we're hitting will be basically the 2, City and Shelby. There are a couple of municipalities that will still have to approve it, dry cleaners, body shops that have emissions that we'll be looking at. I know we looked at wide as far as Shelby County, where most of the pollutants were, it is City of Memphis, unfortunately.
And so for the meter fees though, that is something that has to be approved by the municipalities.
Yes.
Okay, so that's separate, so I just want to make sure you're clear on that one. That's the only thing they need to approve, that the county and the city don't necessarily what the MWD and the city would.
Correct.
Okay.
So I realize we're asking a lot, and September 12th is right around the corner. And I think we want to do this right and make sure we get a good proposal. So I don't know what the board thinks about pushing it off a couple weeks in September. I know it's mandatory by ordinance that we have to meet in September. So. Yeah, it's March and September.
I mean, really, it doesn't have to come before the board at a meeting, correct? Can we not just get an email of what y'all's, thoughts are?
I guess in my mind, I'm thinking we will have something to vote on in the next meeting. And we will have to vote on it, right? As a board. Yeah.
Yes.
We do not have it today.
You just don't want to put undue,
Right.
stress on them trying to get something done within 4 weeks or less than 4 weeks.
Right, that's why I'm asking about the end of September.
I'm sorry, point of order. Can I ask a question? So, I'm just trying to get it straight here. Shelby County Health, and then this is the board, like, okay, are there any task force? Or is it just you all just made these decisions at this meeting? There's no little smaller task force to help get the ball going?
Volunteers with the meeting.
Okay. Time is of the essence.
Yes.
I really can't even believe that. I would think that you would want to do working lunches or something.
Yes.
Because this is really traumatic to everybody. And we're just a fraction of the people that can be here.
To the working of the board, we are required to have open meeting, and so any meeting of the board has to be public record. Therefore, it's a bit of a slow process. We had hoped, in fact, to have this meeting as a working meeting, meaning we would not need to be in a public forum, just to discuss as we've discussed. However, there's benefits, as you have seen, of having it in the public and in the open. We are working and unfortunately it is, once a meeting, once a quarter at this point. And as we have the capacity. Yes, go ahead.
So to answer your question, and Chris, according to the Open Tennessee meeting, you can have a workshop. I mean, my wording, Reagan. You can have a workshop.
And I think our ordinance says something. You have to.
So this meeting here is considered a public meeting. Notice was provided. I believe everyone had an opportunity to provide public comment. This is considered a public meeting. However, there are very limited circumstances where the board can meet to discuss a specific issue if it's for informational purposes only. No decisions can be made or discussed that's pertinent to an issue that you have to vote on or make decisions about, such as a permit fee. But if it's like informational meeting to discuss like what your process is, what your duties are, to go over the already published ordinances, things of that nature, you can meet to informally discuss procedure and process that you already have, but not to make any formal decisions. That's how that would work. But this is a public meeting.
The
scope, so basically the scope of smaller individual meetings, anything discussed among the board members is supposed to be what's called by the sunshine law, to my understanding, which I have legal counsel here now, which is, thank you, is that it must be available to the public. I cannot reach out and have a private meeting with Mandel over here, and we decide, hey, you know what? We think we want these fees to be such and such. And the two of us decide, okay, well, let's agree on it. Okay, that's fine, that's good. And we said it, and nobody else knows what's going on. So the whole point is that we have to have what we do in the open, because what we do affects the entire public.
TVA and MLGNW have private meetings all the time without our knowledge. They're stuck in 500 million gallons a day. Nobody knows.
Raymond Chandler, County Attorney's Office. I also like to add, so I know there was a discussion on how to get the proposed water fees submitted. So in that case, the Shelby County Health Department, we can submit an email with proposals, but it seems like it needs to be already discussed among you all, because you cannot send emails back about what you think the proposed fee should be. You should probably already have a working draft to vote on for the next meeting.
That's what we're supposed to do.
Yeah. Wouldn't that just be for the meter fee? So the fees for like monitoring well permits, boring permits, new construction permits, those don't have to go before the municipalities, right?
They're gonna play nice in the sandbox. They don't, but we will come out to speak to each of the municipalities so they know what's going on. Because your constituents are gonna come to you guys, not to Shelby County and complain. They're gonna go to Germantown, Carterville and say, hey, why is this happening? So we wanna make sure everyone's on board. So that is something we will do. That's just plain courtesy that we will need to do for each municipality to do that. So no, once it's approved by us, it's good to go. But again, we would like to get in front of your people to say, this is what's happening. Even if you say, give us a letter, that's good, that will suffice. But I'm giving you my word that we are willing to do whatever it needs to do to make sure this goes through. Because what I don't want to happen is just Shelby County commissioners, and it's inundated with people from Bartlett and everywhere else saying, we didn't know anything about it, we didn't know this was happening. That will cause a lot of issues, and I don't want to catch any of the municipalities off guard. So just in fair practice, that's something we are going to do just to make sure that everyone is aware before we even go to Shelby County Commission. This is what's happening in the why. Just like Alex is saying, boom, 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 boom. This is why we're going to do it, and this is how it's going to be applied.
Okay, so we've now, I believe what you've mentioned is a strategy for reaching out to municipalities, which is item number 6. We talked about water quality fees, and we are trying to specifically separate the fees versus the water meter fee. So that would that'll be a whole nother level of, going to the different, a whole lot of stuff involved. Yeah, you got it. All right, so the function, number 7, the function of the groundwater board as relates to well construction codes. And I put a little, I don't remember why this is. Did you have something, Sonia, for us to speak on number 7? Function of the groundwater board as relates, so maybe just overall, if we could have a quick, since we do have legal counsel here, function of the groundwater board as relates to construction codes. There is a code, written code.
I think you were proposing some changes to the code, correct?
Yes.
And I think you were asking for it to be in a red line format. You didn't think it was red line format. So you want them to come back with a red line format. Is that correct?
It's on the website.
It's on the website.
Let me look at the website.
Okay.
It's on there. So Chris, Mike,
But we approve it.
Chris.
Right. They physically.
Okay, go ahead.
So this is the one with the revision. So what we did here, you can click on each one and it takes you to the changes. It takes you to the changes when you click on. But if you,
It would, and it may be so on your website, it would be nice if we could see. Microsoft has a function called track changes, which allows you to see all added and removed text.
I think it was actually both on there.
Mike's got some.
I think it was split. I remember seeing this, but I think it was split.
It was on there, yeah,
Yeah, it
and
was
we did,
on
we
there.
changed it to this, so we can go back to the red line. Yeah. Because this is just the comments, so. Okay, we can do that, Chris.
All right, great, thank you. Okay, then any other business? If we're getting toward the end of our time, I think we're all. If your stomach's not growling yet, it probably will be soon. Any other business that we might have? I have plenty of things that I prepared, but we can discuss them hopefully in September toward the end. Alex?
Can we decide on the September meeting? Or do we want to do that kind of at the same?
Oh.
Can we decide on the September meeting, or we can do it by email, either way?
So, do you want a later date? Is that what you're?
I think I just want to give y'all some time.
Okay.
We're asking for a lot.
So we've already put out a public notice for the 12th. We wanted to be in compliance, but we did change that. Is that right, Raven? Alex, we have an appeal.
Oh, I see.
Well, can we let them know that it'll be later in September?
If you want. Do she have a letter? Raymond Chandler.
Sorry, Raven Chandler. So you can
Still, if there's an appeal, you can still carry on with the already planned meeting. But you can also, I believe the chairman, unless it's something different in your rules and regulations, the chairman under Robert rules, the chairman or a normally majority vote can call a special call meeting to discuss specifically that issue.
Do you need the extra time to talk to particular aquifer? If you're okay, then we can do it at that meeting. You just let us know if we need to have another meeting.
I will do that. We will need another meeting. I'm gonna say that now in front of everybody. We will need another meeting. With this little staff, there's no way, thank you, Alex, by the 12th to have this done. So we will need another meeting later.
Okay. So you work out the details. If you can have that meeting changed and then have one meeting, we're okay. You just come back to us and let us know what you propose today, and you can turn it around for public notice.
September 26th is Thursday, if we're set on meeting on Thursdays.
That will be fine.
So we just make that a plan.
Chris, can you clarify that meeting on the 26th is that also to hear the appeal, or is that's for everything?
That's dependent on, if you can make that work with the person that has to appeal, that's to get back and notice no. You can make it work. If they can get the person with the appeal to move it, then we can have that one meeting on the 26th. I'm saying if you can ask that person if they can come on the 26th. But is that fair? Yeah.
And we would also have to coordinate with Ducks Unlimited as well.
Okay.
To see. So if not, the alternate location may be the health department if this room is already reserved.
Well, it's too tiny. I'm like, we couldn't hold everyone and the public.
Right.
At our current location.
Right, so let's check with them to see.
You just let us know.
And I just want to be clear. So what I'm providing to you, to the board, or what we're providing to the board is our fees, what we propose compared to protect our aquifer and what the state, what TDEC, what their fees are. Also to give you a list of our, I guess, duties, what those fees will, what the fees are going toward for the operations of our program. Is that correct?
Yes, for yours, yes.
Yeah, I think just the caveat, what I was asking for, I think the comparison is good. I would love to see a collaborative proposal presented. So not just the comparison, but an agreement between.
Okay, gotcha. Between us and protect our aquifer.
Yeah.
Okay,
yeah, I think
that works. But also showing you what TDEC, what their fees are as well.
Yeah, we just want to have a column where we can outline what the existing fees are. If you can meet with Protect Our Aquifer, you come up with a resolution, but if not, what you want to propose or what Protect Our Aquifer proposes is fine as well. And what TDEC is looking like, or what TDEC fees are, and then what you do that TDEC doesn't do. So we'll kind of understand in our county what we're trying to do to protect our aquifer versus what TDEC does for the rest of the state. I think that's fair.
Okay. And we've got the, yes.
It's been nice to be together and discuss these items. This was a first, a working meeting. We did not have appeal. We knew we did not have an appeal, and we want to discuss these rates for the particular well fees, construction fees. So now we have a little bit more to go back and think about. And so I believe we're now at the point of adjournment. We will hear back from the board as to when our next meeting, we have one scheduled for September. The date, I believe, is the 11th. Yes, is it 12th? Thank you, Orkilla. And if we can, we'll have it on the 26th, either replace and or to the board's preference, 2 meetings or 1 if possible, correct? Mike, is that make sense?
Yeah, I guess it really makes a difference. I mean, it makes sense to do it in 1 if possible. But that all depends on whether we can get this room or not.
Having that said, I suppose, Orkilla. Has everyone please make note that you were here? There's no proof, there's no writing, so we have, Orkilla was asking, would you please sign? Do you mean sign in at the table?
Yes.
Okay, if you haven't signed in, please do so. Thank you for coming. Anything else that we might have? And I suppose since this is a meeting, even though it's a working meeting, we would like to have, how about a motion? Any motions? I feel like we're at a point, we're ready for some sort of motion.
I'll second it.
All in favor, say aye. Aye. Any opposed? Thank you. Thank you for coming, and we look forward to meeting again. Have a good day.